There is a period in the scientific history. The experiments are on psychology of a psychiatric patient, and Carl Jung and Freud, they are continuously analyzing the data from the patients, and they are scientifically answering all the problems related to thoughts, emotions, love, affection, passion, and related issues. So very famous, the father of modern medicine, and Osler. This period is called the golden period in the history of human beings. This scientific evaluation reveals the analysis of psychology of a patient. After that, later, the mood elevators, mood depressors, giving rest and sleep medicines, tablets, changed the entire history of psychiatry. It becomes a branch, a specialty now. So very often it is happened that a psychiatric patient himself brought another patient, psychiatric patient, to the psychiatric clinic. It is possible in this world. So first, at least he knows that he has a psychiatric disease. This patient, another patient, don't have any psychiatric disease, and still I'm doubting that he has a psychiatric problem like love failure, attraction towards other things, and too much religious. So we cannot judge a psychiatric patient statements completely but partially. So at what age he is mentioning all these things is coming to attention. After that, it is going to dissolve itself. It is not treating both, it is treating completely already a psychiatric patient. So a elderly patient with psychiatric problem, a forgetfulness, he is continuously going on forgetting all the things, financial things, documents, important documents, and related to health, well-being, forgetting. It is not possible a person who has passion and euphoria continuously going to forget. But in psychiatric disease, it is possible. So like this psychiatric branch of medicine is continuously growing, helping people like this. So in in my videos I told that the doctors that are psychiatrist itself, psychiatrist is having more tendency to commit suicide, as Osho told. So as Osho mentioned at those times, or it is a divine thing, or it is a code, we have to learn and understand fully. Is it possible a person simply telling that all psychiatrists or doctors are going to die? Is it possible in this world? It is not possible. So, Carl Jung analysis is sometimes helping that he is too much worrying about the patient hysterical nature of a patient. At those times, we don't know patient having hysteria psychiatric disease. This mental condition is going to spread. Even one single patient at this locality, in this locality, are having the genes of that hysterical patient is going to spread. So when you are simply here sitting, a wonderful condition, we are discussing about the followers of Freud. We are discussing, and we are the followers of Carl Jung, or we are the followers of Freud, or we are the followers of the famous personalities. We are discussing here. We are hearing the other voices. What type of this nature is called? Hysterical spread of psychiatric disease in this area. When it is clear, like all the things are clear, everything clean and pretty, this atmosphere is cool. How do you going to know that some person is suffering with hysteric spells? The analysis of Carl Jung is limited. The Freud is limited, but the analysis of Carl Jung is unlimited. So this is going to help that only that hysterical disease. Now today we are going to learn that only hysterical disease only going to spread locally or on this area. So I am discussing here the psychiatric disease here. Some persons are very eager what I am doing here. The other locality people, there may be possible that the spreading of their hysterical spell or otherwise here the hysterical patient disease is spreading here. So when you know after that there will be doubt. Again this type of hysterical spells, hysterical spread of psychiatric disease is continuously going to spread or not. So whose hysterical disease is this? So your question your question is answered. The problem is solved. So we are not entertaining anybody, neither male or not female. We are giving a message here. Only when you have the thorough knowledge of this means so spreading always this the hysterical spells and giving messages like this always until you are going to understand. After that it is disappear. Like doubts also spreading. So it is affecting. So affecting hysteria disease is not new to this world. Again you are going to understand. So a old age patient, psychiatric patient, having passion, having everything, continuously forgetting all these things. It is very bad situation that we are everything forgetting. Again the passion, again the uh, songs, again the dance, again the meetings. think like it. So this answer also going to be solved this manner. So very big achievement in the golden period of Carl Jung and Alfred um, Freud, Freudism. So very golden period. So through this they are clarifying, giving suggestion to all the patients. So when it is affecting, has to affect everybody, irrespective of we are familiar, we are affected, we are psychiatric, we have a psychiatric problem like anxiety, what it is. So this problem also cleared when it is cleared. So whose problem is this? Irrespective of person is suffering disease, this your motive should be sympathetic way. This is the guidelines or line. When you not this line, when you misbehave here, you are going to be punished. So what are the other effects to this old patient, psychiatric patient is like this. His siblings or his children are like this. A person who is educated person is like this. Just because of not understanding the history. So many times to that old patient we are repeating, he is not going to understand your line because he is too much worrying about religious things. We don't want to hear Englishmen. We don't want to hear Hindu men. We don't want to hear even his own religious thing because he is the only sufferer of hysterical spell. So, in the community, how you are going to deal with this? And there is a problem like this thing, everyday problem, the everyday problem. And when you are seeing the beautiful college days, this local people attention is different. When those people who don't have this problem, they are going to face this problem, their feeling is different. So I am not here the role playing or mentor or guru something. They are continuously going and finding these things again and again. This thing, is it possible to face this problem? Definitely, because it is congenital, genetic. It has a predisposition, genetic predisposition, means bone disease. So some localities are suffering, and hill areas are these semi-tropical countries like India or tropical countries, other tropical countries. We can guess that how many people are suffering with this. So we are not here, this psychiatric patient, psychiatric diseases, a psychiatric clinic, a psychology of a psychiatric patient and how diseases are. We are hearing continuously hysterical spells. Just hearing. That hearing is giving that much of pain when it is become a organic disease. Means this is affected like brain cancer. but the area of brain affected with this. We are not going to cure this. It is not revert back to normal condition. Then what you do? Sending a person to mental hospital or psychiatric clinic, keeping there, otherwise in a jail or asylum, keeping there, that is the only problem. The messages are still hearing, there is no problem. So when psychiatric diseases are very silly, when you understand that you are reluctantly going to tell somebody something, in psychiatric disease, you are understanding so many things you are not going to express anywhere. So this Freud, Carl Jung of those period, William Osler. After that, Harrison and so many books and medical branch reach out to all the audience of this world. Since so many years, this knowledge is carrying through generations and generations. We are just seeing or hearing hysteria because it is locality, it is related to locality. We can say that, we can say like this. It is related to one person. Since morning, every day, I am clearing doubts of other persons like these problems, psychiatric problems. So when you understand, it is along with the patient, he don't spread, he understands it. But when it is a congenital one, when it is a genetically transmitted, there is a chance it is traveling generation on generations. First, remove this. First, understand this. Build a psychological muscle in you. Where it is psychological. So everyday duty, what you are doing is your psychological muscle, like spiritual muscle.